Yes, thank you for that introduction, and absolutely thank you for the invitation to speak here today. This is absolutely an honor for me. I don't get out of my lab very much. Like many of you, I'm quite fearful for the future of academic and clinical research at the University of Minnesota, like most are across the country. After hearing that the NIH funding, both direct and indirect money, was cut or eliminated, my worry immediately went to my young oncology patients and my ongoing ability to contribute meaningfully to the scientific community. I've come here today to defend them, as well as to repay the system that is the root of my success. You see, I grew up in rural Indiana. Doesn't sound actually all that different than some of the other speakers today. As you can imagine, this was not a very diverse place. I regularly experienced blatant sexism based on gender norms that eroded my ambition from a young age. My family was also of very little means. My mother and stepfather were not college educated, and despite working quite hard, we lived paycheck to paycheck. Needless to say, I spent much of my adolescence feeling small and unimportant, and a lingering sense that there was no hope for escape. But a lifeline came in the form of acceptance to Indiana University on a scholarship. In my first year of classes, I realized that my work ethic could help me excel in this new and open, progressive setting. I even started to convince myself that becoming a doctor was a real possibility. But what ultimately changed my outlook and trajectory altogether was a recommendation I heard from a professor in one of these large lecture halls intro to biology classes. He stated that aspiring med students should consider finding research mentors and doing bench research. And taking that advice to heart, I searched the university's website and found an interesting lab and contacted the PI. His name was Dr. Clay Fuqua. Over the next 2 years, this amazing early career, NIH-funded PI introduced me to hypothesis-driven inquiry and dozens of lessons that I would never be taught in college courses. He modeled what it meant to be a scientist, and he made me feel like I could do the same. So the moral of the How I Got Here story that I'm telling you today is that what Dr. Fuqua did, he did because that's how NIH funds were designed to operate. By framing a sturdy foundation more than a century ago, institutions across the country established data-driven systems of collaborative academic science. NIH-funded labs not only perform the research outlined in those grants, just as importantly, they mentor and inspire the next generation of scientists and physicians, whether there's a single dollar dedicated to that or not. It's been calculated that every dollar NIH awards generates nearly $2.50 of economic activity. But based on my own experience, this is a major underestimate. Without the long-established U.S. commitment to the NIH, I would not be helping people in the way that I'm doing today. I certainly would not be enrolling patients, young oncology patients, onto life-saving clinical trials or performing novel research that I hope to translate to clinical trials myself. NIH funding has proven its worth, and I'm here to voice that worth includes not just the direct ability to uncover new knowledge that will lead to better health for everyone, but also its less defined but equally important commitment to pay it forward to the future of science and medicine. I want to thank all the other amazing speakers who have been here today for telling their stories, and I also want to thank you for your time and attention for mine. Thank you, everyone.